2 years ago, the COVID-19 pandemic hit Guyana, taking its first victim, a 52-year-old Guyanese woman visiting from the United States. In today's COVID-19 update, Health Minister Dr. Frank Anthony gives an overview on how the pandemic is being handled here in Guyana and the strides that have been made in managing the disease.
So I think it is a significant day because the 11th of March 2020 also marked the day when the WHO declared COVID-19 as a pandemic. And through the international regulations, 2005, they made that declaration. So it's also a significant day for this reason. And once it was declared a pandemic, a number of things went into place. So we in Guyana, unfortunately, while we knew that there was a new disease called COVID-19, unfortunately, I don't think that the then government had made a lot of preparations for the detection and treatment of COVID-19. As you would recall, with our first patient, that person came from New York, came to Guyana, subsequently developed the disease, probably was infected before, developed the disease while here on vacation, and then got sick. And the presentation was more one where the doctors believe it was a cardiac presentation. Nobody thought about COVID, and because of that, when that person came to the accident and emergency, a lot of the doctors and nurses and other healthcare personnel that came into contact subsequently had to be isolated and then monitored to see whether or not they would develop the disease. So our initial case was basically not detected clinically, but afterwards, after the person died, then they felt that maybe they need to test for COVID. And when they tested for COVID, it came back positive. When we came into office, there were a number of things that we had to rectify. So in terms of testing, there were very, very few tests that were being done. And in some instances, less than 5 PCR tests were done per region, per day. So that really did not give you a sense of how widespread the disease were, how many people were infected because of the limited amount of tests. And then the personnel from the Ministry of Health at that time also set out very stringent measures on how the test can be used. And only if somebody had a certain set of clinical symptoms, then they should be tested. And we know at the beginning of this pandemic, there were about 80% of the people who would have mild symptoms or no symptoms at all. And it's only about 20% of the patients would present with a more severe form. So if you're only testing for the very severe form of the disease, or who you suspected to have the disease, then obviously you would be missing quite a lot of people. So at the beginning, because of our lack of testing and the infrastructure to test, and these stringent criteria, we were excluding a lot of people who were probably positive. The other thing was that in terms of people dying from COVID, many of the persons who died, we didn't know whether it was from COVID or any other cause. In addition to that, our capacity to treat persons who had the more severe form of COVID was extremely limited. We had very few ventilators in the system, and I recall in the early days when we took over, Georgetown Hospital was the main center where people were being treated. We had probably about 7 beds there with ventilators. And therefore, if we exceeded that number, persons could not get medical attention, or if they needed a ventilator and we didn't have one, then it was a struggle, it was a challenge. They also bought a few ventilators and sent them out to the regions. But when I visited Region 1, for example, Region 1 had a ventilator that was not hooked up to anything. There was no oxygen to it. Similarly, in some of the other regions, they might have had a piece of equipment, but it was useless because it wasn't hooked up to anything. We had to start working not just on building capacity centrally, but we had to start working on building capacity in the regions as well, because patients would come to the regional hospital and they needed care. So we set aside in each of the regional hospitals a set of beds where we can treat COVID-19 patients. And then we worked very diligently to make sure that not just beds, but we were getting monitors and ventilators in place so that we can treat people if they had respiratory distress. And we built out that system. And you would also recall that when we took over at the Ocean View Hospital, it was basically a shell. So a building was there, painted, but there was no water going into the building, no sewage system. The electricity was not connected. There was not a single piece of equipment, no beds, no ventilator, no nothing. And we had to start working on getting that going as quickly as possible. So within a month of taking over, we bought beds, got the equipment in, and start putting the hospital in place so that we can get our first patients there by the following month. So by September, we had our first patients going into the Ocean View facility. Now we have expanded testing, where PCR testing, we have the capability just at our National Public Health Reference Lab of doing more than 2,000 tests per day. That's coming from a situation where we had about 5 per day to where we are now at the central lab being able to do about 2,000 per day. We have moved from a situation also when we weren't able to do PCR testing at the regional level. Now we have equipment at many of the regional hospitals that can do PCR. These are called Gene Experts machine. And we can do PCR testing at the regional level and get back the results within an hour. We have also, as you know, introduced antigen testing. And we literally have thousands of these tests in almost all the regions. So anybody needing to do an antigen test can get that done quite easily. So in testing, we have really ramped up testing. And it shows in the numbers that we have. So right now, if we look at testing for over the last period, so in 2020, the amount of tests that was done overall, and this is after we came in and ramped up testing, we did 38,548 tests. In 2021, for the whole of 2021, we did 387,266 tests. And just these, for January and February of this month, we have already completed 116,048 tests. So overall, since this pandemic started, we have completed 548,182 tests. we were one of the early adopters of treatment, because initially there was no specific treatment that was available for persons once they got infected with COVID. But being a viral disease, we know that you can interrupt the life cycle of the virus. And when the antiviral medication remdesivir came on the market, we were one of those countries that adopted it quite easily and start using it to treat our patients. So we start giving remdesivir for those patients who were hospitalized, and we continue to do so. And then when we looked at the results of baricitinib, for example, and we realized that patients who were put on baricitinib, we were getting very good results with them. We immediately start using baricitinib with our patients. So our treatment protocols have been very up to date in terms of what the science was telling us, and we have used that. And because we were early adopters of these types of treatment, we would have saved a lot of lives. So with first dose vaccination, we have 435,509 doses that have been administered. That's about 84.9% of our adult population. We also have for second dose 332,605 doses. That's about 64.8% of the adult population. And then for 12 to 17, we have 33,938 doses that have been administered. That's 46.5% of the age cohort. And you have 24,612, or 33.7% of that age cohort, as second dose. In terms of booster dose, we are now at 54,195 doses.